Good afternoon, everyone. Thank you for joining me today for this unexpected briefing. I wish I was here with better news on the Friday of a beautiful May 24th weekend. Unfortunately, we have a confirmed cluster of COVID-19 cases in the Central Health region in a part of the Notre Dame Bay area. There are 7 confirmed cases, 7 presumptive cases, and 1 probable case. And while all these cases appear to be linked at this time, the source is still under investigation. This signals to us that there is community spread in the area, although we do not know the full extent at this time. And Central Health is working very hard to trace all contacts and find the source of this cluster of cases. Because of this, however, effective midnight tonight, communities from Lewisporte to Summerford will move to alert level 4. If you are in these communities, please visit our website to review the restrictions that will be in place. Everyone must keep their contacts to their household unless it is to provide support to another person. It is essential to keep your contacts low. You should only enter public spaces for essential goods such as groceries and medication. If you have even one mild symptom of COVID-19, please arrange for a test by completing our online self-assessment and testing referral. Symptoms include fever, including chills or sweat, a new or worsening cough, shortness of breath or difficulty breathing, runny, stuffy, or congested nose that's not related to seasonal allergies or other known causes or conditions, sore throat or difficulty swallowing, headache, acute loss of sense of smell or taste, unusual fatigue or lack of energy, a new onset of muscle aches, a loss of appetite, vomiting or diarrhea for more than 24 hours, or a child displaying small red or purple spots on the hands or feet. Central Health will be establishing community testing in the Lewisporte area for more information will be forthcoming on this through public advisories from Central Health. Throughout this pandemic, we have called on you so many times to support one another, and we ask this of you once again. These communities need our kindness and compassion. We need people to feel safe coming forward for testing. We can only control an outbreak if we can find all the cases associated with it. So please be kind. Send your positive thoughts and love to these communities today. Stay safe this holiday weekend. Remember, keep your contacts low, maintain distancing, wear your mask, and most importantly, stay home if you're unwell and get tested. And hold fast, Newfoundland and Labrador. And with that, I'll turn it back to you, Leslie.
Thank you, Dr. Fitzgerald. For the benefit of our speaker, there are 4 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. Are these cases spread out in the region, or are they centralized in a certain area?
So right now, what we know is that most of these cases are contacts of each other, and they are connected to each other. There are some cases that are spread a little bit, but for the most part, the cases are focused in that area of Notre Dame Bay that we mentioned in the special measures order.
Okay. There isn't anyone in the confirmed case count under 20. Can we assume that there's no school involved in this so far?
At this point, there doesn't appear to be any impact to schools that we know of. Of course, certainly it's very early stages of the investigation, and that could change in the coming days, but at this point, no, there doesn't appear to be.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Fitzgerald, if all the cases appear to be contacts or linked to each other, can you explain why we're deciding to go with the level 4 lockdown at this time?
So at the moment, there does appear to be, quite a few contacts that we're tracing. So we want to be able to give public health the opportunity to be able to do that. We want to make sure we're stopping any onward transmission of these cases. In all likelihood, this will be a variant. We don't know that for sure yet, but in all likelihood, just given the numbers of variants that we're seeing across the country, and we know that travel is how it gets here. So, we know that these can spread very quickly. So we're trying to reduce some of that onward transmission for while public health is continuing to work through and to try to find a source. We do know that, excuse me, we do know that, while these cases are connected, of course, we're looking for these cases and these are the contacts, but we do have people in the community now who are calling saying they have symptoms. So we are seeing an increase in calls in the area that would indicate to us that there are people in the community with symptoms. So that may not be related to COVID, but obviously that's a bit of a concern for us, for Central Health.
And the region is moving into alert level 4 as of midnight. Of course, this is a long weekend. Many people on the highway right now may be heading out to that area. For those that are traveling into this area now for the long weekend, what's your advice to them, and what do they need to know?
Well, certainly if you're traveling into the area, if you're going camping, we would recommend that you stick with your household bubble, that you stay, in your camper and on your campgrounds, and try to distance yourself as best as possible from the people around you. We know that outdoor activities are safer than indoors, so, try to stay outdoors as much as you can. You really shouldn't be going to anywhere, any public spaces unless you really have to. And if you've rented a cabin or whatever the case, make sure you stay within the cabin and try to keep your distance as best you can. Wear your mask whenever you're out. Those sorts.
Thank you.
Our next questions are from Lucas Wall with CBC. Please go ahead.
Hello, Dr. Fitzgerald. I noticed that there was a slight uptick in hospitalizations in the Central Health region. There's 3 there now. I don't know if you're able to say if those are related to this cluster, but is there any cause for concern that these cases might be more severe given the possibility of variants?
So the hospitalizations that have happened are related to cases that we've already known about. So it doesn't appear to be related to this cluster. And after we see a certain number of cases, we've had above 65, 70, even more cases over the last little while. You will expect to see a certain number of hospitalizations with that number of active cases. So it's not unexpected that we would see hospitalizations. Might be a little unusual that they're all in Central right now, but I don't think we can read too much into that because the numbers are so low. So we can't say at this point that this appears to be more serious or anything like that.
Okay.
Or cause more severe disease.
Right. Given the timing of this, is there any concern, given that we are coming up to the long weekend now, and that, as Ricky mentioned, that there will be more people on the roads and more people moving around? Is there any cause for concern that this could spread?
Well, that's certainly our concern, and that's really part of the reason why I wanted to do this today, is to make people understand the importance of following the guidelines that are in place. COVID is still with us, and as I've said many times before, you can do everything right, and you can still catch COVID, and you can still spread it. And so we need to make sure that we're all doing our part to keep our risk as low as possible. So we're keeping our contacts low. We're physically distancing from our contacts, from people who are outside of your steady 20, and you're really making sure that you're wearing your mask when you're going into public spaces, and really just trying to avoid large gatherings as much as you can, to wear your mask if you are at one of those large gatherings. So really important for people to stick with those public health measures that have really proven to be the most effective at reducing the spread of this virus.
Thank you.
Our next questions are from Beth Penny with NTV. Please go ahead.
Thank you. Do we know how many people in this cluster have been vaccinated, and if they're past 14 days since their vaccination?
No, sorry, Beth, I don't have that information right now. It's still just very early days, so we're really just collecting all that information. And public health at the moment is just focused on finding all the contacts, getting those contacts isolated and tested. So that's something we'll be delving into as time goes on, but it doesn't really change at this point what we have to do. So we don't have that information at the moment.
Thank you. Will there be any COVID-19 testing available for people in Central who might be experiencing no symptoms of the virus right now?
Yeah, so anyone who has symptoms should fill out our testing referral tool on the website, and certainly somebody from Central will give them a call, book an appointment. But Central will be setting up some testing clinics for community testing in that area over the weekend, and they'll be sending out advisories with all the information on that. So certainly keep an eye out for that.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Yes. You were talking about people traveling to that area. What is your advice to people in that area who are considering traveling outside?
Yeah, so at the moment, we would recommend that you try to stay in that area if you're from that area, and recognizing that some people may have already left, and if that's the case, once again, we just recommend that you stay, within your household group as much as possible. Try to avoid your contact with other people. Wear your mask. It's very important. We know that even though we've got this cluster of cases, not everybody in the area obviously is going to be testing positive for COVID-19. So, we want people to be able to get out and enjoy the weekend, but we do want people to be really careful. So getting outdoors, doing those outdoor activities is important, but we want you to make sure you're taking extra precautions, wearing your mask, keeping your distance, not going to parties, not going to anywhere where there's crowds, that sort of thing.
Thank you very much.
Richard Duggan with VOCM, do you have a final question?
I do. Someone reached out to us at VOCM and informed us that one of these positive cases today may have recently attended a funeral. I'm just wondering, are there any specific events, businesses, or anything like that Public Health is currently looking into as a result of this cluster?
So I'm not aware at this time, but as I said, I'm not on the ground going through all the details of the investigation. But if Central Health feels that there are places of exposure that need notification, either if they can't do that through, the place having a contact list, so they may be able to reach out to people individually and not have to do a public posting. But if they're not able to do that, then they'll certainly let us know if we need to publicly post anything.
Thank you.
Lucas Wall with CBC, do you have a final question?
I do. We recently saw a cluster of a sort of similar size in the Codroy Valley, and the sorts of restrictions and testing that are being rolled out here today. We're using that situation as well, and that seemed to be a successful endeavor. So, Dr. Fitzgerald, are you optimistic that these restrictions again will be able to control any further spread of the virus in this case?
I am optimistic. We've certainly proven, many places have proven time and time again that if we get on something very early and, try very hard right from the start to reduce the threat of onward spread, that you can quickly get on top of things. So we're hopeful that this hasn't gotten too far. We do know that there is some spread right now, and we would not be surprised if we were to see more cases in the communities. But we hope that certainly we'll be able to prevent as much of that spread as possible.
Thank you.
Beth Penny with NTV, do you have a final question?
Yes, I do. I was just wondering if there will be COVID-19 updates in the form of a news release over the next 2 days with this current cluster.
Yeah, I think it is my understanding that there will be news releases, and certainly we'll be keeping people up to date as necessary. As well, Centre Health maybe we'll have news releases or advisories, public advisories. So certainly we would recommend that you keep an eye out for that as well.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks, everyone, for joining. I think this is just a reminder that COVID is still with us, and I know we're really hopeful. We're talking vaccines, and everybody's really hopeful that things will start to get back to normal. But we still have to deal with COVID for a little while longer. So, remember all those things that you need to do to keep your risk as low as possible. Keep your distance, maintain your steady 20 contacts or lower, and wear your mask when you're in indoor public places. And please, please, please make sure you get tested if you have any symptoms. The most important thing is to try to catch any of these cases before there's a chance to spread. You might think it's a cold, but you want to rule out that it's not COVID. So please, if you have any symptoms, don't just assume. Please get tested. Thank you, and please have a safe weekend. Stay safe on the roads, and take care.